Project Adam and teach you hands-only CPR. So we're going to start with introductions. Would you like to begin?
Yes. So, hi, my name is Angelina. I'm currently a sophomore at Carroll University, and I am in the nursing program. I hope to become a pediatric GI nurse, which is a nurse that helps kids with stomach issues, and then I hope to go to graduate school.
My name is Mia. I'm also a sophomore in Carroll University's nursing program, and after school I would love to be a pediatric cardiology nurse, which helps kids with heart issues, and I would also like to go to graduate school.
And I'm Brianna. I'm also a sophomore at Carroll University, and I would like to become an ER nurse that works in the emergency room. So what is Project Adam? Project Adam is a program that began after the death of Adam Lamel, a 17-year-old high school student. Adam suffered from a sudden cardiac arrest. This program teaches others about the life-saving measures that can be done to save someone from a sudden cardiac arrest. These life-saving measures include CPR and AED use.
Alright, so you may be wondering, what is sudden cardiac arrest? So sudden cardiac arrest is a condition where the heart suddenly and unexpectedly stops beating. So if the heart stops beating, then blood is going to stop flowing to your brain and other vital organs that help you go through life and perform everyday activities. And if not treated in minutes, it can result in death. And to understand how cardiac arrest works, you just need to know how the heart works as well.
So how the heart works, blood pumps in through your heart and goes through a whole cycle, and it goes in a certain direction and a certain rate. When that rate is kind of altered and irregular, that is called an arrhythmia, and that can cause serious problems eventually, and it can cause the heart to stop beating, which would cause the cardiac arrest. When your heart's kind of beating too fast, we would call that tachycardia, and if it's beating too slow, that's called bradycardia. But yeah, we're really concerned about those irregular heartbeats.
So what is CPR? CPR stands for cardiopulmonary resuscitation. It consists of chest compressions and giving breaths in order to keep the blood pumping to the heart and the brain. Keeping the blood flowing increases your chances of survival in a cardiac arrest. CPR can also double or even triple the chances of survival of a sudden cardiac arrest.
Alright, so what is an AED? So an AED is called an automated external defibrillator, and it analyzes your heart rhythm. So if your heart rhythm's off, like we talked about tachycardia and bradycardia, the AED, when it's attached to your chest in any way, it's going to sense that and send electrical pulses to your heart to help it get back into rhythm.
And then when you're performing to do CPR on a patient, when you know that they're in a sudden cardiac arrest, first you want to assess the scene where they are, and you want to make sure that they are in a safe place, and you want to make sure that you'd be safe approaching them. So say if like there's a fire going on, you kind of don't want to approach the situation because you don't want to harm yourself. But if it's safe, go ahead and approach the person, check the person, see if they're responsive. If they're not, tell them, hi, I'm going to be performing CPR, I'm CPR certified. You want to make sure that you are, so they cannot sue you later on. And then you would call 911. With this, you want to try to see if anyone's around and ask them to call 911 for you. But if not, if you're alone, you can go ahead, get your phone, call 911, but make sure to return back to the patient and make sure they are safe as well. And then you would also ask someone to get an AED for you. So you kind of instruct one person to call 911, one person to get an AED. If you're alone, you would have to do this yourself. Just make sure you're doing it at appropriate times. And then you would start your chest compressions after that. And then
So when performing CPR, we're only going to be teaching the chest compressions today, but normally you would do chest compressions and breathing. But the first thing that you need to remember is hand placement. So for hand placement, you're going to want to place the heels of your hands on the center of the chest, and you're going to place one hand on top of the other. Hold your arms straight with your shoulders directly over your hands, and you're going to use your arm strength to do effective chest compressions. So during compressions, you're gonna push down on the chest at a rate of 100 to 120 beats per minute. And you're gonna be giving 30 compressions, and then normally you would give 2 breaths after those 30 compressions. For breathing, if you were to perform breathing, you would tilt the person's head back and their chin up to open up their airway, and then use mouth to mouth by giving 2 breaths and watching for their chest to rise and fall. So this is just going to show you the chest compressions and the rate to do it too. So we're going to use the song Dance Monkey. So then, after you're doing chest compressions or before, you're going to place the AED on the person. So with this, you're going to turn it on and follow the prompts. You're going to expose their chest and wipe it dry and take any medication, like maybe patches that they have on. And then you're going to attach the AED pads and plug it in to the connector. So one goes on the right side of the chest below the collarbone, so right here, and the other one is going to go right below the lower part of the left side of the chest. So it demonstrates it perfectly in the picture. And you're going to make sure the person is not being touched and stand clear of the person. And you're going to push analyze to let the AED look at their heart rhythm, see if they need a shock, and if they do, you're once again going to make sure nobody's touching the patient, you're standing clear of them, and deliver the shock. And then you can begin CPR once again after delivering the shock if need be.
And then on this slide, we would have you guys do a Kahoot. Yeah.
And this would just be to test your knowledge of what you learned over the course of the presentation. And after that, we'd ask about any questions, and we would close up with just a quick little Q&A or anything that they're wondering, and then the presentation would be done. There we go.